Hello, my name is Dr. Hamza, and today our session is about emergency medicine. Our guest for today is Dr. Hamid Shahzad. We will go towards our guest and will ask about him a few questions. Assalamu alaikum, sir.
Wa alaikum salam.
Sir, would you please introduce yourself further for our audience?
My name is Dr. Hamid Shahzad. I've did my graduation from Khyber Medical College. Then I did my surgical rotation here in Lady Reading Hospital. Then I had an opportunity and I went to UK after doing my PLAB exam. There I was introduced to this new specialty, emergency medicine, and I did my training in emergency medicine and my exams in emergency medicine. So I chose emergency medicine afterwards. So I'm basically duly accredited, a surgeon as well as then turned physician.
Thank you so much. It's so wonderful to hear that. So we basically come across two terms, that is FRCEM and MRCM. So what's the basic difference between these two terms?
Right. First of all, we have to understand what they stands for. So it's a member of Royal College of Emergency Medicine and fellow of Royal College of Emergency Medicine. It used to be MRCEM and FRCEM in the golden old days when I was doing my training. Now there is some differentiation in the terms as well. Now, in those days, when you were training, you were expected to do MRCEM at the level of ST2, ST3, and then after MRCEM, you would have become a registrar, and after training for 2-3 years as a registrar, you will be allowed to sit in FRCEM exam. At that time, MRCEM exam was like a separate exam. It was a 3-part exam. So it used to be either SAQs or OSCEs. So first was the MCQs, then the short question answer, and then the OSCE exam itself. And you would be given an MRCEM degree. And then FRCEM at that time was 5 parts exam. So it was a MCQ, SAQ, critical appraisal, now they call it a quality improvement project, but it used to be a thesis or a project that you have to do, and then exit OSCEs. So there is a difference in attempting the exams now. They have changed the steps as well as there has been still they are giving MRCEM degrees in certain countries, but not in the UK itself. If you are in UK, you will be going through the FRCEM completely. Maybe the last year, or this is the last year, that like as far as I understand, in India they have got like some exam centers and they're waiting for the last persons to finish their MRCEM OSCEs, and they might finish that program. There is a certain level of FRCEM. If you clear that, then you can be called an MRCEM passed personnel, like you can still become a member. But the aim is to actually achieve FRCEM.
Okay, thank you so much. Well, there is always a motivation story behind every doctor on the kind of specialty they select. So what was that story behind your case?
As I said, I was a surgeon by trade, so I did almost 3 years of my surgical rotation here in Pakistan, and then I went to UK. So I joined my surgical rotation in UK. So the first rotation when I was offered, like, emergency medicine was one of the main parts of the surgical rotation. So I was doing that for 6 months, and the clinical lead of that department. I was doing my surgical rotation in Hertfordshire. It was just outside London. It's a very beautiful place, and I was doing it in Leicester Hospital, Stevenage. So the lady who was the in charge, clinical in charge of that department, of emergency department, after having worked for like 3-4 months with her, her name was Silla Reid, and Silla was continuously nagging me that like, look Hamid, you are emergency person, you are not a surgeon, I'm telling you, you are emergency person. Though she helped me with the surgical rotation, she made me complete my surgical exams and rotations and everything. So once I completed and having worked in that department, having seen how the emergencies are dealt with, whatever we were doing here was completely opposite what was like we were supposed to do. So I still remember she said, now that you have completed the surgical rotation, what do you want to do? So I was anyway, like I was more tilted to the emergency medicine by that time anyway. So I actually surrendered, and that was I think so that was the best decision of my life that I've made at that time. And all the credit that I would have given to the way that like my career went and everything, that was Silla Reid who convinced me that like I am someone who can do emergency medicine. And as you can imagine, a surgeon who is very reluctant to become a physician again, but like I think so that was the best decision ever that I made.
Indeed, it is an inspiring story, sir. Sir, emergency medicine, so it is termed as the mother of all specialties. So why is it called as the mother of all specialties?
So in Pakistan, like in the context of Pakistan, I would say that like whatever you see, like we call it casualty or accident and emergency or emergency department, whatever you name it, I think so we are way back than what is offered beyond the borders of this country. I think so the patients coming to emergency department deserve much more than what they've been given in these circumstances. So here people might not think so that it is the mother of all the specialties, but abroad it is. And the reason why, that the doctor or the physician or the consultant working there is someone who is expected to deal with all the emergencies. So to sum it up, this specialty, and people might not know that like what emergency medicine is. So when an ambulance arrives and the door of the ambulance opens, if it's a 2 days old baby, if it's a 70 years old adult or elderly patient, if it's an MI, if it's a fall, if it's an accident, or even if it's a firearm injury, whatever you can think of, any emergency, for the first 4 hours, that patient is your headache. So you have to treat it, you have to stabilize it. And if it's a gynae patient, if it's a pediatric patient, if it's a surgical patient, so you have to diagnose it, you have to stabilize it, and you have to refer it to the appropriate specialties. And you are expected to do emergency procedure, life-saving emergency procedure there and then. So this is the specialty, and I don't think so that we have achieved that part of it in Pakistan yet, but I hope so that we will see in the coming years.
Okay, sir. Thank you so much, sir. Sir, what is the scope of emergency medicine in world and in Pakistan in the coming years? Where do you see Pakistan in this field?
So, as far as the scope is concerned, like countries who has got like emergency medicine as their training, I can talk about UK. They have introduced it. They have got a Royal College for it, Royal College of Emergency Medicine. So many people are getting trained, and still, at any given time, it's at least 40% deficient as far as consultants are concerned, as far as like the workers are concerned in UK itself, and they are mostly relying on the locum doctors to fill those shifts. The same goes for the Australia, and UAE hasn't got any program. If we talk about like Saudi Arabia, UAE hasn't got any programs like this, so they are dependent on the doctors who has actually achieved these degrees. In Pakistan, they've started the program like around 7 to 8 years ago, and there are people who are doing FCPS emergency medicine at the moment.
So now coming towards the exam, sir, how much steps are there in this exam, sir? Like starting with the MRCEM primary and then going towards the FRCEM.
To be honest, the whole exam is actually 5 steps that you have to achieve. Like MRCEM, if they allow a separate exam, then it's 3 steps. FRCEM itself is a 5 steps exam. Yeah.
So, like we are students, like we are fresh graduates, and we want to start preparation for this exam, sir. How can we start? Where to start, sir?
So for FRCEM primary, it's the basic sciences. So you have to like, just like if I give you an example, like FCPS part 1 and a bit of a clinical is always there, like applied basic sciences that like you would say. And there are so many resources available online as well as like on hard copies as well. Nowadays it's very easy to get the material for the FRCEM primary.
Okay, sir. Okay, sir. As compared to other exams like MRCP, MRCEM, how much is the difficulty level of these exams?
Right. Difficulty level, if I put like the most difficult exams in UK, you will be amazed that like we came across anesthetic and ICU are the most difficult exam in UK, and emergency medicine was termed as the second most difficult exam in UK, but the passing rate is quite good.
So, what about the exam centers? Are they available in Pakistan about these exams?
No, these exam centers are not available in Pakistan at the moment. Pakistan Society of Emergency Medicine is continuously in contact with Royal College of Emergency Medicine. We want at least the FRCEM primary or MRCEM exams to be done in Pakistan, and hopefully you will hear a very good news soon.
How about the English proficiency exams? Are they needed for these exams as well?
Now, you don't need a certificate or English proficiencies like IELTS or OET for the exam itself. But in the OSCEs, you have to be very proficient. The emergency medicine, the whole specialty is about communication skills. It's verbal communication as well as body language. So you have to be very good at both of them. So if you don't have the certificate, at least you have to be proficient.
Okay, So we have a last question about it, that how much do ER physicians make?
Right, it's a very good question, and the reason, one of the biggest reason that when I was telling you that I'm very fortunate to have made that decision, choosing this specialty. But it's not always about making lots and lots of money. It's about the quality of life as well. And I think so one of the best quality of life is for the emergency physician. And the reason why I say so is that you can do private practice, which is allowed in Pakistan, but if you choose not to do it and you have got a handsome amount of money given for your specialty, then you are blessed. You will have the best of both life. You will have a profession that you like. You have got a good amount of money, as well as you have got time to spend with the family. Coming to UK, so in UK the starting is around £3,000 a month. For a consultant, it's around 84 to 94,000 first year consultant that they will get pounds sterling. The locum amount in UK is around 80 to 100 for junior doctors, and 100 to 130 depending on the areas per hour for a consultant or a specialist level. When we talk about the UAE, Saudi Arabia, they are paying amazing amounts of money. So that's one of the problems, that even if someone does FCPS emergency medicine, they will try to go abroad and work there. Here in Pakistan, compared to other specialty, the emergency physician are paid very good amount.
Okay, so we are coming up towards our last question. In the meantime, when we are attempting these exams FRCEM primary and intermediate, how can we make our CV good? What sort of courses we can take in the meantime? How can we make chances bright for having a job abroad?
If you're looking for jobs in emergency medicine, or if you think that you're planning to enter into this specialty, then the first thing on the CV would be to show that you want to be in this specialty, and to show the urge for that. I think so the best thing to start with is the resuscitation courses like BLS, ACLS, ATLS, APLS, and the list goes on. But because it's such a specialty that it involves everything. It involves your ultrasound skills, ultrasound guided procedures. So stepwise you can go higher and higher on the courses. But to be very honest, the best thing to start with, the first step would be BLS and ACLS, and then improve on that.
Yes, sir. So tell us about these courses. Are these courses offered in our hospital right now, sir?
If I talk about Lady Reading Hospital down here, yes, we do. We are blessed that the emergency department learning resource center has been accredited for the last now 4.5 years as American Heart Association training site. So we have been conducting BLS and ACLSs for our doctors down here, as well as anyone wants to do it. So it's a certified AHA courses that we provide in our hospital itself.
Thank you so much, sir. And thank you for your time, sir. It was a wonderful session indeed, sir.
Thank you so much. Thank you.